The Community is Our Responsibility by Jamie Blake. It is our jobs as healthcare providers to protect and serve our community. We are the ones that need to look out for the well-being of our communities. They depend on us to ensure our communities are safe from disease and what we are contributing to the overall community. In our communities, we're responsible for promoting overall community health and well-being and addressing the causes of disease and disability. The local health departments need to engage diverse communities in developing a broad spectrum of solutions to today's most pressing problems, including chronic disease, which is the leading cause of death, and other complex community health issues. The case management is a system of managing integrated health and human services for a defined group of patients or clients, in this case, our local community. Case management services are organized to support the patient or client with wraparound services and to enhance their independence. Wraparound services are community-based interventions that provide a multitude of needs for children and their families that typically involve some level of mental health needs as well. Now, within each region, state, county, and city, public health services directly implement the core public health functions, which are assessment, policy development, and assurance. The State Department of Public Health coordinates communication, funding, and policy among the state's county and city public health organizations. The state and local public health departments touch many community agencies such as food vendors, agriculture, waste disposals, recreation sites, and lead exposure monitoring, ammunitions, monitor child care in residential facilities like nursing homes, and the licensing of nursing home administrators. We are responsible for implementing public health programs, monitoring and assessing health status, and coordinating a group for concerns, including funding allocations. The Women, Infants, and Children's, which is the WIC program, is an example of a way we have assisted our community. We are reaching out to these mothers and families to ensure that the younger people in our communities are healthy and they can receive classes on knowing, what is healthy for them and how to exercise and what types of food that they should be eating so that we are minimizing upcoming health issues within our community. The public health system as community-based organizational network that includes the full complement of public and private organizations that contribute to the delivery of public health services for a given population, including governmental public health agency as well as private and volunteer entities. Research and system management are the basis for a healthy community. We then need policies and way to enforce these policies. We need to ensure we are informing the public and giving them ways to protect themselves against disease and illnesses. We need to evaluate each other to ensure that our staff is up to par. Increasingly complex conditions such as childhood obesity and multi-drug resistant infections suggest that the conceptual divide between the public's health and the clinical care is fading. Ethical decisions made in the acute care setting, for example, decisions to resuscitate extremely low birth weight infants, can have a significant impact on public health. Just as public health interventions will affect clinical care, for example, routine testing of newborns for PKU. There's a criteria to evaluate the ethics of public health policies and programs in every such situation. If you want to follow along with me on the slide, the goal of the public health measure must actually have the potential to improve the public's health. The public health measure must be effective in achieving its goals. The burdens of the public health measure must be recognized. Burdens should be minimized and alternate measures need to be considered. The public health measure should be fairly implemented. The burdens and benefits should be balanced. The Affordable Care Act established the Prevention and Public Health Fund. to provide expanded and sustained national investments in prevention and public health to improve health outcomes and to enhance healthcare quality. To date, the fund has invested in a broad range of evidence-based activities, including community and clinical prevention initiatives, research, surveillance and tracking, public health infrastructure, immunizations and screening, tobacco prevention, and public health workforce and training. In the Consolidated Appropriation Act of 2012, Congress initially directed HHS to establish a website for reporting on uses of funds made available for the Prevention and Public Health Fund. I have pulled a few agencies, so I'm going to let you know about the agency, what they are representing as far as the program, how much was allocated, and explain a little bit about the plan which is going to be used with the funding. So, chronic disease and self-management program. We allocated $8,000 to that. And the plan was to award continual grants to selected states and a resource center to help older adults and adults with disabilities cope with their chronic conditions by providing access to evidence-based chronic disease self-management programs and to assist state grants in developing plans to continue providing these programs after the grant period ends. Another one, cancer prevention and control. We allocated $104,000 to support the National Breast and Cervical Cancer Early Detection Program, which provides breast cancer screenings, outreach, and case management services for qualified individuals through state, territorial, and tribal health organizations. Community health is a part of the public health system, focusing on the assessment, evaluation, and implementation of activities directed to improve the health of a target population. Community health services monitor the health status, characteristics of the people residing within specified geographical areas. When we collect this information in our community, we can pass it along to the big agencies, such as the United States Department of Health and Human Services, the Centers for Disease Control and Prevention, and the National Center for Health Statistics to help control outbreaks and work together for solution and preventive actions to set and achieve goals for keeping the local communities safe and healthy. It is imperative that we are keeping our community informed. When things take place, such as an epidemic, we need to be sure we are passing along the information. These people in our communities need to be aware of what is taking place, how they can help themselves, how possibly they can help somebody else to prevent an outbreak or the disease. They need to be educated. That's the number one thing, especially in a community. We need to ensure that our community is educated. Because if they're educated and they are keeping themselves healthy, that will help us focus on the people we know have chronic conditions. I would like to thank you all for your utmost attention during my presentation, and have a wonderful day. These were the references used for my presentation. Thank you again.